Hi, my name's Kamden Hilborn, and this semester I focused on the use of caffeine for treating apnea of prematurity and studied the long-term developmental outcomes of caffeine therapy. So to give a little background on the condition that is apnea, apnea is defined as cessation of breathing for more than 20 seconds, and it's super common among infants, especially those that are born prematurely. Around 90% of all babies that are born within 28 weeks of gestation will develop the condition. And in 2018, around 17% of infant mortality was credited to these low gestational periods. So there's a lot of health risks that come with being born prematurely, and one of those is apnea of prematurity, and that can also increase the risk of death, disability, as well as developmental delays that come with being born prematurely. So to treat apnea, caffeine citrate is most commonly used, and the way it works, chemically wise, it works as an adenosine inhibitor. So what that means is while it's treating the apnea, it actually also affects the infant's brain and the brain's ability to preserve ATP levels as well as monitor and protect brain cells. So due to these kind of adverse side effects that it also has, people have questioned the safety and efficacy of caffeine for treating apnea because of its use on a small developing infant and whether, are there possible health risks that could come up later in life due to these effects on the brain. So figure 1 is a graph that kind of demonstrates gestational age and the probability of developing apnea. So as you can see, apnea rates are going to be much higher among lower gestational periods for these infants. So to complete this systematic review, I pulled sources from PubMed and CINAHL, both online databases, and I ended up narrowing the search down to around 8 credited articles to study. So the articles mostly included randomized controlled trials that were measuring caffeine citrate and placebo saline administered at the same volume. There were 2 studies that were a little different than the other 6, and one of those compared an earlier caffeine therapy treatment to a late caffeine therapy treatment, and then the other one compared a higher dose of caffeine compared to the standard dose. Figure 2 kind of demonstrates the standard doses of caffeine that is currently used in clinical practice, and that is what all of the randomized controlled trials refer to as the standard dosage of caffeine therapy. So after analyzing all of the sources and going through and pulling out information, I completed a data extraction table and summarized the results. And caffeine really proved to be beneficial compared to no treatment. And there was no evidence of negative long-term impacts of caffeine, but there was some evidence of some really beneficial impacts of the caffeine treatment. So a reduced risk of motor impairment was found. There was no negative findings for sleep quality or neurobehavioral outcomes in the placebo-controlled trials. But yeah, a reduced risk of death, disability, and mechanical ventilation use was found in the earlier caffeine therapy too, proving that earlier caffeine therapy is actually better than receiving the therapy later on in their infancy. So yeah, overall, the standard dose upheld its trials too. So the standard dose of about 20 milligrams per kilogram of body weight proved to be pretty normal and healthy for these infants, even as they develop on later in life. So the major findings and the major things I was focusing on, so the developmental outcomes, analyzed among the placebo-controlled trials, all showed that caffeine therapy was beneficial for long-term development. There was no any glaring negative outcomes, really. It was found that caffeine had better long-term outcomes regarding sleep quality, neurobehavioral development, and motor development as well. Early caffeine therapy also really stood out compared to late caffeine therapy, like I said earlier. The findings of this review could be used to help guide clinical practice for the treatment of apnea of prematurity, ensuring that it's healthy and it's good and there aren't many health risks compared to the benefits, basically. the standard dose is still being upheld in clinical practice, and in my studies, it showed that it should be, that it's improving it. But yeah, so the majority of the articles I used were placebo-controlled trials. So all of the findings that I had were pretty strong in their evidence. I had many p-values discussed in my data extraction table, and the limitations on my study were pretty few and far between. I mean, I think one thing that could have been improved is larger study sample sizes. So the populations could have been larger. There was a couple that were less than 100 participants. So increasing those sample populations could improve the study, as well as I think making sure that all of the studies were within a certain time period, because one of my studies was a little old. I think it was like 20 years old. So ensuring that all of those studies are within the same time period, and maybe getting some bigger clinical studies going now that are focused on studying infants from infancy all the way until maybe their adulthood, because I think the longest age gap I had was around 11 years post prematurity, so when the children are around school age. So it'd be interesting to maybe study how are they developing maybe when they're in college now? How is their behavioral development going now that they're out of grade school and, more developed, even more so. So it'd definitely be interesting. There's a lot more studies that can be done. But yeah, overall, all positive findings were found, and it was definitely interesting getting to learn a little bit more about prematurity as well as apnea of prematurity for these infants, because, you don't really realize how common it is for these infants to have breathing troubles. So yeah, thank you for listening and taking a part in SURF, and I'd like to say thank you to the health science department at Carroll College, and then also Gerald Schaefer for assisting me in this project and continued support and guidance. Thank you, and have a wonderful day.